this time, members of the public may comment on any item not appearing on today's agenda. Public comment can and will be limited to 3 minutes. Is there anybody here wishing to speak under public comment? All right, seeing none, I will close the public comment period and continue on with the agenda. I will now take up item number 2, which is a report on public safety facilities financing options. Item A, a presentation from the Health and Human Services Agency regarding criminal justice, health, and mental health care services. Mr. Britt.
Good morning, Mr. Chair, members of the committee. Jason Britt, HSA Director. Appreciate your time here today. So just a brief introduction and a brief presentation on how we've been financing our criminal justice, health, and mental health care services in the county. This is just kind of a quick rundown of what we're going to talk about today, some brief background, talk about the contract renewal again, breakdown on the current revenue, and then some discussions about the future. So as many of the members of the committee and maybe members of the audience have known, is HHSA has been sort of the provider of criminal justice, health, and mental health care since the agency's inception in the mid-90s, probably even before that, but unfortunately my history doesn't go back that far.
Steve's does.
Yeah, maybe.
Not super.
So I know since the agency formed around 95, 96, we have been the HHSA Health Department division of the agency has been the actual provider of health and mental health care up until July 1st, 2013. And there was likely many reasons behind that decision. Primarily, I think, organizationally as a county, that's where the board and probably the CAO at the time decided it was best housed. And primarily was because the health department has a mandate to provide health care for indigent individuals, the Welfare and Institution Code 13,000. And so it sort of made sense to house it there and sort of use that cost center and those realignment funds to kind of fund that, fund those services. In 2012, 2013, the Sheriff Bill Whitman, Chief Probation Officer, I believe it was Janet Holnadel, might have been Christy Meyer. It was kind of like in the time there, and our previous agency director, Dr. Dirksen, made a decision to go out and bid services from a contractor because primarily HHSA was struggling to provide quality and timely services. So the sheriff and the chief probation officer has the legal mandate to provide adequate and timely health care to inmates under the Title 15 regulations in the state of California. So the agency was struggling with that, and that decision was made. So on June 11th, Corizon was awarded a 3-year contract, and we have now extended that contract twice.
Jason, I'd like to just add to that the Board of Supervisors was also engaged in that conversation, right. And part of our justification was concerns about our liability, because there was a fear from the agency that they were having a difficult time providing the level of service that was necessary, and there was a great fear that if that was the case and they couldn't meet that obligation, that the liability would flow to the county, which could be huge. And then by having a third party come in that would assume that liability, no matter what, whether we were providing a good service or a poor service, there's still the potential for litigation and liability. By transferring it to a third party, that would take that onus off of the Board of Supervisors, off the county.
Thank you. So that's a great perspective. And again, the case law around what is adequate and timely has substantially grown, I would say, at least in the last 5 to 10 years. So that continues to be something that's watched by all. So now we're sort of this is the beginning of year number 5 for Corizon. We technically have one more year extension if the board and or the agency decided to exercise that option. But that kind of gives you some of the background behind how the services have been provided. And so essentially since June of 2013 or July 1st of 2013, the agency has really functioned more as sort of the contract administrator versus the provider. In 2017, 2018, of course, the contract is $12.040,000. 1.8 of that goes to the juvenile detention facility and probation youth facility, and then 10.2 is spent on the remainder of our facilities throughout the county. Again, this is a comprehensive services contract. They do take on full risk minus a few minor exceptions. So they pay for all services, they pay for all staff, and there are a few exceptions, I would say sort of very large exceptions, where either the cost would come back to the agency in the county, or we would negotiate some cost sharing. But by and large, we've not really had to do that very much in the last 5 years. So they provide medical, mental health, dental, vision, pharmaceutical, and utilization management, and as part of their, and this happens for both juveniles and adults. Again, just a quick snapshot of the historical contract costs. And again, the contract costs are something that every county in the state, and I would say probably the nation, grapples with. This is a very rapidly growing expense pool for a number of reasons. One is case law continues to dictate adequate and timely. So that begins to, with every regulation, with every law, adds cost. The acuity of our inmates, how sick they are, continues to be on the rise. Lots of chronic diseases, lots of costs from violent, gunshots, stab wounds, those kinds of things, and mental health. Mental health continues to be, even though it's only a portion of this contract, mental health is really going to be the largest cost driver, I would say, in the next 5 years. Irregardless of whether the county provides a service, the contractor provides a service, that is just getting so much attention right now, and it's getting so much litigation, and the need is so great. So this year, our current cost in 17-18 is, again, 10.2 and 1.8. The juveniles there is in the bottom shaded portion. So it does show you that we've kind of had not a huge increase over the last 5 years, but it is ticking up. I just want to take a few moments to talk about the revenue breakdown. So this is how we fund the $12 million contract. So through the AB 109 Community Corrections Partnership, they provide $1 million that goes towards inmates who get incarcerated in our county jails as a result of their AB 109 status. And then the agency contributes $7.1 million, and it's broken down at 4.4 in health realignment, 1.9 in mental health realignment, and then $789,000 for block grant for minors. I do have to say that I do think the block grant for minors is at risk for going away. This is a year-to-year award, and looking at the terrain at the federal level, I think that this is probably one that's, I would say, within the next 3 years is probably going to disappear.
So it's federal dollars, not state dollars.
Sorry?
It's federal dollars.
It's all federal, right. So so that would be an additional $788,000 we would have to find to backfill that grant. And then we have a general fund contribution of $3.8 million to make $12 million. So I wanted to talk a little bit about how we got to the $3.8 million general fund contribution, because I think it's important just for historical context. So we got to the general fund contribution of 3.8 as a result of AB 85. AB 85 was a bill that was introduced in 2013 that legislated a formula to claw back monies for indigent health care from the counties because the assumption was all of your indigent eligibles would be now go to Medi-Cal. So as a part of our funding strategy as a county and as an agency prior to Affordable Care Act, the agency paid for indigent health care for jail medical out of the indigent health care monies. We commingled those monies with the general population who was eligible for the Tulare County Medical Services Program. And typically that funding stream, depending on the economic cycles, proved to be pretty valuable and pretty much covered the cost. And when when the cost exceeded the revenue stream, then there typically was a negotiation between the agency and county about how to handle that. So prior to AB 85, our total health realignment was somewhere around $14.2 million. And roughly $8 million of that went to indigent health care. That includes the jails and the Tulare County Medical Services. After AB 85, our realignment was reduced to 7.9, with the balance being for that indigent health care. So, but the inmates in the jail are not eligible for Medi-Cal, and there's really no quote credit for that, and so the ability to leverage those indigent health care funds really disappeared with the AB 85 redirection, the state calls it. I like the term clawback, but redirection. And so out of that 7.9, we commit $4.4 million to CJ Healthcare, with the remaining roughly $3 million-ish going to support the health department's mandates. So, which means you have a very slim, well-run health department. The South County Detention Facility is scheduled to open in 2008, and from what I understand today, that there's approximately 510 beds, 16 beds for special needs, 9 for outpatient housing, and we have a $9.6 million ballpark estimate to provide medical and mental health care to that facility if it was fully opened and fully running. So we are still working very closely with the Sheriff's Department to better understand their phasing plan and to ensure that we have clear understanding so that we can work with our vendor to get sort of better cost estimates to match the number of inmates that are going to be housed at South County and what the timing is going to be. So for the first couple of years, based on what the sheriff presented last committee meeting, the initial years of startup will likely be less than $9.6 million, but I don't have a number yet to give to you until we've been able to ensure we're clear in understanding what the sheriff's plan is and that Horizon's able to work those numbers for us. So again, that brings up the idea of sustainability. So assuming, I'm just going off the assumption of a 9.6, day one, this is sort of, and I do have to say that despite the phasing plan, at some point, you're going to get to the 9.6 because that facility is going to be fully open, even though we may be redirecting some of our inmates. The facility over 5 to 7 years with the healthcare environment that we're in right now is going to be costly. The healthcare environment right now, if you do not know, is super competitive. It is super crazy with the wages that people are having to pay. It is just super phenomenal right now at this time. You can't get an RN for less than $48 to $56 an hour. You can't get a physician for less than $200 or $225 as a starting pay. So I say that because that's also part of the cost drivers. So we have the healthcares, we have the services, but you have this super competitive environment. And of course, we live in one of the, I won't say the few areas, but we do live in one of the areas that have a licensed medical provider shortage. And I say licensed medical provider because that's at all classifications of licensed providers, irregardless of level. So again, and then of course, most people who work in the jail want premium wages because it's not the most, it's not a hospital, I'll just say that.
It's not the most desirable environment. That's probably
It's not the easiest environment to provide services and not the easiest population, I'll say. So going back to, as I digress, going back to sort of a sustainability analysis, which is what we look at the agency, what's coming up in the next 5 years, how are we going to, look at this? As you can see from the chart there, the expenses become fairly large, and the expenses exceed the revenue sources that have been available to pay for these services. I'm not suggesting that the agency would not still continue to commit some level of funding and there would be some level of that, but it just simply, when you have a $7.9 million health realignment revenue and you have a $20 million health contract, you're in the red.
Jason, the contract that we have with Corizon is based upon headcount. It's not a flat sum for whatever the population is in the jails.
There is a base average daily population, and there's a per diem if it exceeds that. But it is primarily an average daily population driver. Now that is about 60% of the costs of the contract because they have to staff with the nurses, doctors, mid-levels for those number of patients. Approximately 40 to 45-ish% of that contract is the services. So that's providing for X-ray, sending them out to the hospital, specialty care, surgery, so on and so forth. Does that make sense? So again, this is something that we've kind of put together, and that's kind of what we look at. Again, we will probably likely have smaller costs in the initial years because we'll have less inmates. But once we know what that looks like, we'll be back to talk about that. So our next steps is to continue, again, as I said, work with Corizon on refining the cost estimates and working with the sheriff to make sure the agency understands what the plan is so we can provide the best services possible. And then also to conduct an analysis on how the agency could leverage some of our one-time funds or excessive funds in our savings accounts to help provide a smoothing period for the county. And then as soon as I have numbers from Corizon that I feel comfortable with and can provide a more targeted and focused dollar amount, I'd be back to this committee to provide that information. So with that, I'd be happy to answer any questions or comments.
Any questions or comments?
Just a comment. I think this is great, very valuable information. I do think that we always should indicate that these numbers are estimates. There are variables. In my mind, the variables are, again, as the sheriff has laid out, the process of opening up the pods. There's also the process of closing down the main jail and redirecting those people. So it's really driven by the population. So if the population is, it will increase over time. We know that to be so, but this time frame is probably skewed to being higher than it will likely be in terms of if it's based upon the population side of it. There are other variables, as you say, that can increase the cost, but that I think it's important to point these out. These are huge numbers, and future boards will get to grapple with these issues.
And I agree. I think they're daunting numbers if you look at them. But if this state continues to go in the direction that it is going in and decriminalizing every activity, we may not have higher jail medical costs because there probably won't be criminals in a few years in this state. So, you might just get a slap on the wrist and vote for a certain political party and get out of jail free card. I mean, I don't know. I don't know what that's going to look like, but it's good to know these numbers and have these presented to us. And I think that it's good that the Sheriff's Department is working with the health department to make sure that we can phase in these increases. And I think it's really important too for the sheriff's department to really look at where it is most efficient in cost to house a prisoner. I mean, can we do it cheaper if we have them in the South County, or can we do it cheaper if we have them at Bob Wiley? I don't know. I'm sure that.
Or can we do it cheaper if they're not in jail at all, but they're on a house arrest or something?
Well,
There's a lot of variables.
But
like
look at 1022, the 1022 money that's coming, and that's going to really focus on rehabilitation of prisoners, and hopefully we can get to a state where we're able to make the vast majority of prisoners be productive members of our society. I don't know. There's a lot of unknowns, but I think it's important that both the Sheriff's Department and the Health Department do work together on a continual basis on a go forward.
Do you have a question, Mr. Chairman, real quickly before Mike gets to you? In the event that our population mix becomes more of what would have been state prisoners, but they're now under 109 county prisoners, the AB 109 contributions, are those fixed, that $1 million figure, or will it go up?
That figure has sort of been fixed for the last few years, and actually we don't always get to the whole $1 million because the AB 109 population is sort of not the biggest driver of the costs. They are there. The 1170Hs, the one that are split.
So when you say the $1 million, we don't just
but
get a check for $1 million. It's based upon the actual
it's based
population,
on the-
and at this point, it's been under the $1 million.
It's been around 950, or some years it's been $1 million, some years it's been a little
But
less.
then my question still is, well, if it became $1.5 million, $10.5 million, is there the ability to increase that revenue stream from the state for the increased population?
That would be a negotiation that the Community Corrections Partnership Committee would have to undergo. They oversee those funds in that budget.
But that's an allocation issue. Is there more money forthcoming from the state in the event that we have more people?
I'm not really sure how the AB 109 allocation comes to the probation office, to be honest.
I know there's been an issue in the past over excess. I mean, because they had a fixed amount, and then as there's an increase over time,
Right.
there's an issue of where those funds
There's
go
been
and how they're
increases and
allocated.
decreases. I'm part of the CCP, so I know some of it is there's been increases and decreases to the base, and the states, tinkered with the formula. But we talked a little bit about it our last meeting. I think our next meeting we're supposed to get a little more definition about what that looks like, and the growth money and how that works. But there hasn't really been a discussion about increasing the healthcare dollars because I'm not sure if the data is there, because then we allocate it within the county of how the programs work.
Any further questions or comments? Sure.
Yes, thank you, Mr. Chairman, members of the committee. Mr. Britt, I'm going to ask questions with regard to the next step slide that you showed. It might be helpful if you could retrieve that slide for everyone's benefit. All right, turning to the first bullet, I think it's an excellent suggestion for you to continue to work with Corizon, the provider, on refining the estimates. Also include the sheriff, as you may have suggested, to ensure that these refinements do take into account what is actually being proposed next year when there is an opening of that facility. With regard to the second bullet, and this is important, you indicate conduct an analysis on how HHSA can leverage one-time or excess funding to help provide a smoothing period for the county. That's excellent. What I would also like you to consider, as we have discussed, is really use your efforts, your initiatives, particularly with your association and so forth, to see if there are additional revenue sources that can be acquired in order to address these kinds of costs. You've mentioned AB 109, their realignment and so forth, but we're focusing on, it seems to me, through this discussion, on the expense side of the budget. I would like to also have some energy, if you will, looking at the revenue side to see if there are no new revenue sources that we can also provide to our stream of revenue. So also to work with the Community Justice Partnership to see if there are other revenue opportunities that can be utilized in connection with this. because these are big numbers, and we're going to be seeing opening very soon. So I'd like to have maximum review of both revenue and expenses before we have to start pulling triggers. Thank you.
I have a different question. Do we have, does Horizon share with us how profitable their contract has been with them? I mean, because that becomes a negotiation point going forward. There's estimates of what costs are going to be, and there may be some actuals that we have to reimburse them for. But my point is that there's an assumption that because the population goes up by X, that there's going to be a comparable increase in the expense. That's not necessarily the case. They don't necessarily have to hire more people. This may be a cash cow. I don't know. I mean, they may be making a lot of money on the current contract. Do we have any way of knowing how well they're doing under the contract?
We don't really have any way of knowing exactly how much profit they make from Tulare County, if any. What I do know is that beginning with this year's contract that the board approved in June, we have set in a number of measures that require Horizon to reimburse us funds if positions are not hired within a certain amount of time.
Remember that.
So there will not be sort of profit from salary savings.
Yes.
So on the services side, I'm not really sure, if there's a profit there or not. But we have set in a number of strategies that, and so far, it looks like that those strategies will pay off some for us. So we'll get probably some reimbursement, at least for the first quarter, of some of those unfilled vacancies. But I don't have any way of knowing.
And I go back to my point. I mean, it's the capacity issue. So if you've got a nurse and there's an additional capacity to handle additional prisoners without having to hire an additional nurse, then there's not necessarily a justification for increasing the contract because there's more bodies. So it becomes a capacity issue. I mean, those would be part of the discussions, I think, with them. Okay, if we have 100 more prisoners, what does that mean for you and your operations? What are you going to have to do? And if they say, well, nothing, I mean, we can handle it with the personnel we have, then that should make a big difference in terms of negotiations at the price.
Yes, we're continually engaged with them on staffing patterns. What does that look like? It's really been the last year that we've really been able to take a deep dive into a lot of this and try to really sort of get the peelings from the onions and try to really look at it. One of the cost drivers for South County is there's going to be a booking facility there too. So booking requires a medical clearance before you're admitted to jail. So that's going to be some cost there, and they're sort of disconnected from Bob Wiley and pretrial and everybody that's out here together. So that creates some of those issues. But we also the agency in discussion with the sheriff, we're looking towards doing an RFP soon to hopefully also get some better cost from other vendors. Because, again, when Horizon came in 2013, there was really only 2 vendors in the state, CMFG and Horizon. Now you have CMFG, Horizon, NAFCARE. You have like 4 or 5 people now who the competition may change some of that landscape. The key, though, for any RFP process or subsequent negotiation for a contract is going to be to really understand and commit to a plan of opening the facility, because that will need to be written into the proposal. And so I just want to make that clear that those are some variables that need to be achieved in order to achieve that milestone from my perspective.
Great. Any further questions or comments? Any questions or comments from members of the public? Captain Wenzinger or Fosman, do you guys want to say anything about this or not? From the Sheriff's Department perspective? You're welcome to if you'd like. Nothing like being put on the spot, so if not, no big deal, but...
Good morning, and thank you.
Morning.
Just to help out a little bit here, and we were discussing, and Jason and I met earlier this week, and we're meeting more often to go over these numbers and figures, and this way we're better partners at communicating. The first 3 years that South County is open is not going to be an increase in inmate population, because at that same time as the main jail is closing down, those bodies are being reallocated. So it's the last 2 years where those numbers are going to start to go up on our population count, if that answers that question for you. Okay? Any other questions I can answer for you?
I just suggest that, I think this is really important, because when I think about South County, I think about your department, the sheriff's department in particular, their budget and being able to do this. But I think this presentation today shows that there's so many other departments that have a potential impact on their budgets and on our county's budget as a whole. And so this is one example. And so if there's other departments that we haven't discussed that are going to have an impact, whether it be large or small, I think we want to make sure that we're having those same type of discussions with them, so that we get a full picture of what the actual cost to the county, not just for a particular department's budget, but for the entire county, what the costs are, so that we can make sure that we're planning appropriately and taking the right steps to make sure that you guys are successful opening South County.
And one other thing too, that as we see this presentation and I think about this, this really isn't an HHSA cost. This is a sheriff's department cost. This is a jail-related cost, providing health to these inmates. So it needs to be looked at in the totality of the criminal justice type budgeting. I don't want HHSA to be held accountable for it. And you can't control the cost. I get that. But this is related to providing care for your customers. So I don't know. We just always have to be mindful of that, I think, too. Yeah, sure.
Mr. Chairman and Supervisor Crocker and Worthley, as a practical matter, we could, at the next ad hoc meeting, continue this dialogue with regard to additional costs, and one of those costs that will be fairly large is the ISF costs. I know Mr. Hess has done a lot of work in this regard, and I think we did highlight that at a previous presentation, but we could have a more detailed presentation to look at what are the cumulative costs associated with the expansion of our correctional facilities.
Okay. Thank you.
All right,
Appreciate you coming up. Any further comments, questions from members of the public? Okay, seeing none, we will now move on to item number 3 on the agenda, which is a report on retirement financing options. Mr. Spada, you can proceed how you would like. I know we have Mr. Keeler here as well to maybe deal with some of these items, but however you want to run this, it's your item.
Thank you, Mr. Chairman, members of the committee, ladies and gentlemen. The matter before you right now is retirement financing, and the theme of this presentation will concentrate on a review of what has occurred very briefly, the options that are available to the committee, and direction with some suggestions if the committee is so inclined to provide that direction at this time. The next slide is entitled Table of Contents, and this page, in effect, provides a snapshot of the sum and substance of what will be presented today. Item 1 will be a CAO review, a brief review of the reports that have been presented to the committee. For example, the Raymond James report, the PARS report, the KNN report, and the Retirement Administrator report. Item 2 encompasses questions for further consideration. In other words, there are some pending questions for additional information that might provide useful to this committee with regard to the options and direction. Specifically, the first question is, what would the actual amount of contributions from the proposed rate change or reduction in the assumption rate? Secondly, what would be the actual estimates or projections of increase in the unfunded actuarial liability? Third, or C, what would be the cost to buy down the assumption rate using the actuary scenarios that are set forth in the economic study, specifically on page 28 of that study? 4, what are the requirements to establish a Tier 5 and defined contribution plan? And then E, another one, which was an add-on by KNN, and that essentially is KNN, our fiscal advisor, would like to look at whether the retirement systems actuary can perform a historical look back to see how a modestly sized POB would have performed in a previous historic equity market high immediately before a significant drop. Thirdly, financing options. There are a number of options, a mix of approaches, if you will. One is continue with the 19-year amortization plan. B, reduce the assumption discount rate. C, establish and fund a Section 115 trust. 3, authorize a debt issuance, for example, a pension obligation bond. E, establish a Tier 5 with or without an added defined contribution component. And F, select a combination of the financing options that have been just identified. And then finally, a request for direction from this committee, which could be further review, for example, the questions that have been considered, a discussion of the options, a recommendation, or other, which is additional questions that this committee may raise, or referral to the board, to Sarah, and the like. All right, next slide. The next slide you have seen during the past presentations, and it's just a recap to show what is the unfunded actuarial liability. Basically, as a definition, the unfunded actuarial liability is the difference between the actuarially values of assets and the actuarial accrued liabilities of the retirement plan. In other words, it's the amount of retirement owed to employees in future years that exceed current assets and projected growth. As you can see, starting in 2016, the balance is $200 million and goes all the way down to $26 million in 2023. Just to refine these numbers, as of 6/30/16, Chiron, Tessera's actuary, estimated the liability to be $238,514,000 at a funding ratio of 83.3%. If you look at the middle column, which is the amortization amount attributable to interest, for the next 10 years, the interest exceeds the payment of the principal, and it's roughly a 2/3 interest payment and a 1/3 principal payment. In effect, this is the debt that is owed by the county to the retirement system to be paid over time. Next slide, please.
Before you leave that, Mike.
Yes.
The difficulty I have with this particular chart is that it does not even reflect what you've just told us about the fact that it's not $200 million, it's $230-some million, and that is as of, I don't know what effective date we're talking about. But what I have been asking for in, I think it was in your questions, is what are the projections? Because we know that we've had a 10-year smoothing period. And so what I've been trying to find out is, where are we going? I've watched this go from like 91 or 92% funded, and this was really after the huge hit in the marketplace, but because of our 10-year smoothing period, it was not reflected, obviously, immediately. But I've watched this go from 91 or 92% funded down to 83%. Where are we going? What is our projections? Because over the next 5 to 10 years, if we hit all the assumptions, and I'm going to jump a little bit ahead. I know that I anticipate that the retirement board is going to go to a 7.25% assumed rate of return, which has in and of itself an impact on our unfunded liability, and we need to have that number. But assuming we hit all that, a 7.25%, all things being hit, all of our assumptions being hit, when we factor in the smoothing, where are we going? Because to me, when we look at recommendations back to our board, it's not about where we are this moment in time. It's where are we going to be 5 years from now? Where are we going to be 10 years from now? Some of those things we don't know, but some of them we have a pretty good idea where we are going to go. I mean, we should have. We don't have the data or information right now to tell us that, but we need that. I don't think we are in a position to be able to make any kind of a recommendation to a board without that kind of information. Looking forward, where are we headed? What do we need to do? What's the smart, prudent thing for us to do, looking at a future that's going to demonstrate, I don't know what our unfunded liability is going to be. Is it going to be $300 million? Is it going to be 350? Is it going to be 4? I don't know. But I think we can have a pretty good idea of what direction we're going to go, where it will bottom out, if you will, and that's assuming we meet all the other assumptions. And I realize those are variables because assumptions are just assumptions, and when they're wrong, as they are with our rate of return, they get adjusted. But anyway, I just want to make that point, that this chart really, to my mind, doesn't do us much good in terms of really looking into the future, because it's a snapshot in time. It really is taken back in 2016.
Thank you, Mr. Worthy. Your point is well taken. This is a snapshot in time, and as I indicated, the chart is obsolete based upon a recent evaluation by the Retirement Board's actuary. And I believe the core of question number 2, when we get to that slide, does touch on what you've been requesting, or what you are requesting. Next slide, please. Retirement contributions. Again, this is a snapshot of the contributions over time from 2016 to 2036 in terms of the obligations for payment by the county to SARA. Just looking at 2016, the employer UAL amortization contribution is 19.9 million. The total employer contribution, third column, is 37.9 million at an employer rate of 14%. The employee contribution is 18.8 million, 7.4. And then you get the idea going all the way down in terms of how the employer contributions are increasing at a significant clip. And if the assumption rate is gradually reduced, as suggested, that 43 million, for example, in 2017 will have an add-on. And the preliminary estimate right now is another 5 million, so that would go to approximately $49 million next year. And it keeps increasing over time. Any questions on this line? Very well. All right, let's turn now to the Raymond James Consulting Report, and this is just a synopsis of what was presented by Raymond James during our last committee meeting. Essentially, they looked at 3 scenarios through a pension obligation bond debt issuance, 200 million, 100 million, and 50 million. Based upon their review, the nominal savings for a $200 million POB would be $75.7 million. At a $100 million debt issuance over a 20-year period, it would be $37.5 million. And if it were a $50 million issuance over a 20-year period, there would be an $18.5 million. The speaker indicated that these savings would actually depend upon investment returns. In other words, if the investment returns that were garnered by Tessera did not hit their mark, then these savings would, as a practical matter, be reduced. Assuming things go fairly well and everything hits their mark, based upon the analysis, looking at number 5, the unfunded actuarial liability funded ratio would increase to 97% at the $200 million POB, 90% at the $100 million POB, and 87% at the $50 million POB. And please recall, I just mentioned that based upon the latest actuaries' evaluation, we are at an 83% funded liability ratio at this time. In addition, the maturity date would be 20 years, 2038, if we went out relatively soon. And the final observation is that it's federally taxable. However, it is not taxable at the state level. The next slide discusses the PARS consultant report. And this focuses on setting up an investment trust pursuant to Internal Revenue Code Section 115. The scenarios that were looked at were a $2 million investment or a $3 million investment under a conservative or a moderately conservative strategy. The investment results were reviewed over a 5, 7, and 10-year period, but for summary purposes, looking at a conservative investment of $2 million, at 5 years, the investment returns net of fees would be $324,000. 10 years, it would be $661,000 at a 4.9 4.5% estimated rate of return. At the $3 million investment, after 5 years, looking at a conservative strategy, net of fees, there would be a $382,000 return, and over 10 years, a $732,000 return. And that would also assume a $1 million annual contribution for the next 19 years. At a moderately conservative investment strategy at $2 million, after 5 years, there would be a return of $377,000. After 10 years, $785,000 at an ROI of 5.68%. At a moderately conservative strategy applied to $3 million, after 5 years, the results or the returns would be $445,000, 10 years, $871,000, at an estimated ROI of 5.68%. Again, this also would presuppose that every year the board would be contributed $1 million during the life of the 19-year plan. The trust setup and administration would be by PARS, which indicated would be fairly easy. By contrast, in looking at our information concerning the Treasury pool, the county earns approximately 1.25%, and the returns then of fees for this year were $5 million. But obviously, there's a larger amount of dollars that is invested. Okay, looking at KNN's report. Several observations were made. First, the POB scenarios accurately compare the cost of debt service with amortization of a like amount. The observation also is that long-term benefits of the POBs are less certain since actual earnings rate is only an assumption. In other words, the market may not produce as much as anticipated, in which case the long-term benefits or savings that were projected will actually be lower. In addition, the POBs amplify the retirement system gains and losses, and in contrast, POBs concentrate market risk by accelerating investments in the pension system. In other words, there would be an investment of a large sum in the retirement system at one time, thus magnifying the impact of market movements. Then finally, market timing. The investment base for POBs are more limited than prior years. For example, as observed by our advisor, what happened with regard to Stockton, what happened with regard to the county of San Bernardino, has created more risk, if you will, with regard to POBs. And investment returns in early years may be more impactful to whether a POB will be successful over the long term, since equity markets are at an all-time high. In other words, since the equity markets are at a high level, if there were a drop, that would put pressure over time to recover those losses, suggesting that the returns would have to be higher as we move through the market in order to recover the losses and still make the savings that were projected through the POBs. Next slide, Retirement Administrator Report. With regard to Tier 4, what is Tier 4's impact on the future UAL? There are some pros and cons. As indicated, it would lower pension liabilities, lower the employer and employee contribution rates. It requires 50-50 sharing of normal costs. It allows for negotiating higher normal costs, and it would include a maximum 2% annual COLA with cost splits. With regard to the cons of Tier 4, it does not fully address the UAL. It results in lower employee benefits. The defined benefit plans are back-end loaded, and there's lack of portability. With regard to a defined contribution plan, it would apply to new hires or for all employees. Legal review would be needed for state and federal law implications. Meet and confirm may be required. We could expand the relationship with our current provider Empower, and it would be possible to evolve to both benefit and contribution plans. The questions for consideration now are as follows. What is the actual amount of contributions to be made by the employer and the employee from the proposed assumption rate change or reduction? Pages 28 and 30 of the Economic Experience Study go over this information. What are the actual estimates of increases of the unfunded actuarial liability? C, what is the cost to buy down the assumption rate using the actuary scenarios? D, what are the requirements to establish Tier 5 and defined contribution plan? And the final question KA recommended is to do a look back and see what the results would have been buying in the market in 2007 and then considering what happened thereafter. Okay, so the options that are available right now are to continue with the status quo, that is the 19-year amortization plan, but as you'll see, it doesn't factor in increases to the UAL over time. The contribution rates, specifically for the employer, increase dramatically over time under this plan. B, reduce the assumption or the discount rate. That's currently on the table, I believe, with Tessera. However, we don't know really what the impacts would be to the employees. We do know that there's an estimate with regard to the impact to the employer for next year, which would be an additional $5 million if that assumption rate were reduced. C, you can establish and fund a Section 115 trust. We have $2 million already set aside in a trust fund. This year we're proposing through our budget another $1 million, so there could be a $3 million contribution to a trust if that were the inclination of the board at a $3 million level. D, you can authorize the issuance of debt through pension obligation bonds. E, you could establish a Tier 5 with or without an added defined contribution plan. Legal review and meet and confer would be required. Or F, you could select a combination of these financing options. So now we get to our last component of this presentation, direction. Based upon a summary of the reports, the questions for consideration and discussion of this committee, you could obtain additional information for further review, or after considering the options that have been outlined, provide a recommendation, or C, you could provide other or additional direction at this time. That concludes my presentation. Thank you.
Okay, questions or comments from board members?
Well, I kind of said it earlier. I think we're not I don't feel like we're in a position today to make a recommendation back to the Board of Supervisors because there's still so many unknowns. Now, we're going to hear a report from our ad hoc committee we met the other day. It's pretty clear to me that the retirement board is moving towards a reduction of probably 7.55 to 7.25% rate of return. So that's going to, that we need to know what is that number. And by the way, it's important for us to have those breakdown of the numbers, because it's one thing to say, what is the amount of the contribution? And you used the term, it's assumed it'll be $5 million. Well, how much of that is for the operational change? How much of it is for the increase to the unfunded liability? And how much is the increase on unfunded liability? That's been part of the problem, I think, for the board in the past, is that we've been dealing with numbers that says, well, it's a $5 million increase or a $2 million increase. And it's like, well, what is the increase predicated upon? Is it interest that we're paying on an increasing unfunded liability? Is it the cost of operation? What is that? We just have seen a number, and I think it's given us we haven't had a complete understanding of what caused those numbers to grow. So I personally think that there's, and again, as I've mentioned before, I think it's very important for us to project out. Because again, we're not talking about something that is for the moment. We're looking at, if we do POBs, you're looking at a 20-year obligation. And part of that is going in with eyes open. What are the projections? If we did nothing, based upon our assumed rate of return, and we can use the new numbers, and we can look at the 10 years of smoothing information that we have, we meet all the other projected assumption rates, assumptions, what do those numbers look like? What are we adding to? Because I'm pretty confident we're going to be adding a substantial amount of unfunded liability, and where will it be? Because as you look at the differences in terms of going out to borrow money, If you're borrowing 50 million, as we saw that, if we borrowed 50 million, you have a certain savings. If you borrow 200, you have substantial more savings. And I'm aware of the fact that there's a variable about what kind of return do we expect the retirement board to get to. Well, if they're going to reduce their expected rate of return, it helps them to be able to meet that target. The risk is reduced. I mean, it's a good sign. It's a good direction to be going. Because when I started out this inquiry, my hope was we would be able to take advantage of the difference between what we now pay the retirement board and what we might pay in the marketplace to buy down our rate of return. Because the further down we can get that rate of return, the easier it will be for the retirement board to meet those targets and thereby not increase our unfunded liability. In other words, meet the assumption rates. So those are my comments. I see Dave is stepping in, maybe he wants to respond to that. But I just don't feel like today, based upon the information we have at this moment, we're anywhere near being able to make any kind of a recommendation back to the full board.
Any further comments or questions from board members? If not, I'd like to have I was going to call on you before you came up, but thanks for making it a shorter waiting period. Go for it.
Absolutely. Good morning, everyone. Dave Keeler, the Tulare County Retirement Administrator. In response to Supervisor Worthley's questions, it's simply too early to give you that information at this point because we don't know yet ourselves. The problem that we have is that the actuary is still completing their study. And while they have provided the economic information, there are still demographic assumptions that have to be set before they can determine what the unfunded liability will be as a result of moving from 7.55 assumption rate on investment returns to a 7.25. In large part, that's due to the fact that we still have demographic issues such as the numbers of plan members who retire versus those who terminate and take their funds out. That's coming later. And so we will have a better understanding of what the unfunded liability will be probably toward the end of September when the actuary comes back to complete their report.
Dave, what about the other issue about that's sort of to determine what is the unfunded liability going to be based upon the changed assumption rates. There's a lot of other assumptions you might be looking at as part of that study. But what about the issue of an analysis that says projections based upon our 10-year smoothing, where we know what our gains and losses have been over the last 9-year period, projecting those, and I realize, I guess what you're going to say is, well, that kind of depends on what we're going to do. The calculations on the other calculations sort of affect that. But is that also being determined at the same time, or how soon would we expect that same information to occur at the same time?
So independently of the information that the actuary is already charged with providing and will toward the end of the month, we have asked for some additional special studies to be completed that seek to address some of those specific issues that you've raised in the past, Supervisor Worthley, and are again here this morning. It does get to be extremely complicated simply because we have to decide which of the assumptions we are going to have them expand or change and assume differently from what the board has already adopted in order to give you a better understanding of, well, if we don't accomplish this assumption, whatever that assumption might be, I've noticed a lot of shorthand being used in the description of an assumption. We're calling it the assumption rate in a lot of our presentations with the understanding, and hopefully everyone has that understanding, that when you're talking about the assumption rate in these presentations, you're talking about the investment return assumption. Well, that's just one of many, almost dozens of different assumptions that really go in to determining what the funded ratio and unfunded liability of the plan will be. So we can, going back to your question, we can ask the actuary to assume that the Board of Retirement has an assumption rate of 7.25%. But what if we don't meet it? What will that do to the unfunded liability for the county? And they can do some projections based on that scenario alone. But keep in mind that the actual change in unfunded liabilities will be a function not of only the return on investments, but also on other things like mortality, the termination rates of employees, salaries, inflation. All of those impact, and some of them have a very significant impact on overall funded liabilities of the plan and contribution rates as a result. So we need to know more information. I've made some assumptions and sent this on to the actuary and to Mr. Spada that we will be wanting to look at those key assumptions that have the largest impact on liabilities of the plan. And those would be the interest rate assumption, the inflation assumption, salary assumption, and mortality, as well as the current benefit formula. So we're kind of focusing our special study around that subset of assumptions, but other things will impact it as well.
Excuse me, would you also want the smoothing too for the losses?
Well, he said that they're doing that also. But part of the issue on the smoothing is you're going to have, again, it's the smoothing. It's as you project out, what are the assumptions that you're going to marry up with that, if you will. In other words, we know 90% of the information on 9 years ago, right? I mean, we have all the years of earnings and losses to make that determination. But as we move forward in time, looking into the future, we have 9 years, 8 years, 7 years. We get down to 2 or 1 years. So one approach is to say, well, using whatever the assumptions that we currently are going to use, factor those in as we move forward to give us a picture of where will we be in 5 years, where will we be in 10 years, recognizing that assumptions are just that. They're assumptions. They're not guarantees by any means. But it gives us some kind of a picture of where we can anticipate being. I just, like I said, I've watched this go from 91% funded to 83% funded, and I know we're below 83% funded at this point as we move forward. But where are we going? Are we going to be 78% funded, 75% funded? I don't have a feel for that, because I think that's part of what the board needs to understand as we look at going out to whether we should do pension bonds and how much, because that number is going to grow, and how big is it going to get? That's my concern.
So the only way to answer your question is not going to be particularly helpful to you, but it is the only truthful answer, and that is we can't predict what the future is going to be. So if we don't know whether or not we're going to meet the assumptions that are in place, or we can assume that we will not, then the answer to your question is the unfunded liability is going to continue to grow, as will the contribution rate.
But Dave, I think the idea is that we're supposed to base assumptions on what we think it's going to be. So if we think it's going to be this, then I understand. It could be more, it could be less. But all of our other calculations are based upon assumptions too. When we talk about what we're paying in, it's all based upon assumptions. So I don't know why we use it one place, but we're afraid to use it someplace else. Let's just use it consistently everywhere, and then if we're wrong, we have to make adjustments like we're talking about now, going from 7.55% down to 7.25%. That's a change based upon reality. As reality strikes us, we have to adjust to that. But it doesn't stop us from using those assumptions from a planning standpoint.
The retirement board has in the past and will in the future, I'm more than just assume, I'm sure, take that same position, but do so in light of discussions with the county in order to try to make sure that the impact that those changes have are something that the county can both afford and maintain going forward. So yes, we can decide on an assumption rate that we feel is achievable going forward. And as with most plans, in fact, all retirement plans, we will adjust that assumption on the basis of, well, what impact is that going to have both on employers and employees currently in order to pay the amounts of contributions that will be necessary to fund the retirement plan currently and in the future in a manner that's sustainable. So as you are well aware, the discussions that we've had in the past over smoothing, which changed about 9 years, well, 7, 8 years ago now, 2009, changed our smoothing period from 5 years to 10 years, was an effort to make sure that the losses that were suffered in 2009 could be paid for through contribution amounts that were sustainable for the county and for the employees. And actually, of course, the county, because it increased the unfunded liability that the county is responsible for. The same is true for any other assumption change that we make. 7.25% is seen by some as an unachievable assumption that we will probably not make 7.25% over the next several years. So the unfunded liability in that scenario will grow. But if we lower it to 7.0, again, in the eyes of some, still too high. How far down do we go to make the assumptions that are in fact achievable without getting it to the point where the plan becomes too expensive for both the plan members and the county in this current environment to be able to pay for? And I stress the words current environment because we don't expect this current economic environment to continue for 60, 70 years, which is really the lifespan of a retirement plan such as this one. So we try to balance the current reality against what we expect to occur in the future as well, and we feel that that's a responsible method for making sure that the county's not overpaying or underpaying currently, and that future taxpayers and plan members don't have to underpay or overpay going forward.
Dave, I'm not being critical of the retirement board. I'm just trying to understand what the county's position is likely to look like going forward. That's all I'm trying to get to, is that information. I fully understand what you're saying. I agree with the approach. I appreciate, as a board member, our relationship with the retirement board, that we've worked closely together to try to make these things work out. I know that this thing of shifting to 7.25 seems to be ubiquitous. Fresno did it. Kern County is in the process of doing it because I sit on the air board and we're tied to Casera, and they're going to 7.25. And I know that Kern County, because of their financial condition, is opting to take 3 years. I mean, even though the assumption rate is going to happen immediately, a reduction, they're going to take 3 years to actually phase into it because they've got serious financial problems in Kern County. So I understand how it works. I understand why it's being done and so forth, but I'm just trying to get a better picture. What I'm trying to get a better picture for us as a board, a board of supervisors, to look at where we're likely to be. And I recognize these numbers are estimates; they're not guarantees. And who's to say that the estimates are off? I mean, nobody could have predicted this kind of a long-term, low-income or low-interest rate environment. I think when it happened back, the number of years ago that it happened. But it is what it is, and it could change. Quickly too. So I get that, but we have to come up with some methodology to get a picture of where we're headed, and I think we have to use the assumed rates that we're going to be adopting.
So, and just in response, it's certainly not my intent either to be argumentative or defensive regarding what the retirement plan is doing and the retirement board. They're seeking to strike a balance between a reasonable amount of contribution rates that will, at the very least, sustain us at the current level of funding or move us in the direction, hopefully, within a reasonable time frame back toward a overall goal of reaching 100% funded level. The chart that was actually shown here earlier of the and the one that you were questioning regarding the overall amount of the unfunded actuarial liability, the UAL, showing in 2016 as $200 million. Given one of your other statements, is actually a fairly good picture of where the county can expect it to go. And that is, if all other assumptions are met going forward, that is what your contribution rates are going to be looking like, and your dollar amounts, because part of the assumption is built in that there will be salary increases. You're seeing the percentages of contribution rates climb to a certain point and then decrease dramatically after that unfunded liability is paid off. Those are accurate tables, but the caveat to them is, of course, is will we meet all of our actuarial assumptions going forward? Not just the investment return, but other assumptions as well. And that, of course, is not likely, which is what leads to the understandable frustration that plan sponsors have with, well, what can we really expect to pay going forward?
Okay, so let me
Difficult.
just follow up on what you just said then, because if that's the case, then that would tell me the actuaries have come up with a calculation that I've asked, what I'm asking about is that, what about this 10-year smoothing? If the smoothing is already factored into the unfunded liability going forward, is that what you're saying?
I'm saying that, yes, going forward, they are factoring that in as the smoothing process completes itself. So yes, in response to your question, they are factoring that in. But what they are not factoring in, of course, is any possible additional losses to assets that would then fall within the smoothing period.
Okay, I guess I have to me, I'm having a little trouble perceiving that, because how we go from 200 to 230 million in 1 year, if we've already been factoring in the smoothing process, I have difficulty seeing how we could have had that kind of a jump, but maybe so.
All right. Supervisor Crocker, thoughts, direction, question?
Yeah.
Establish tier 5?
Establish tier 5. Defined contribution. No, we won't go there. We did that last time. I guess for Mr. Keeler, while you're up here, what you mentioned that there is still taking a process to figure out some of the data for the actuary. Do you have an idea of when we might have that type of data so that we can know when that is? Or
The actuaries are well, there's two factors that impact that. Number one, the retirement board has to make a decision on the economic assumptions that the actuary will then use to complete their final valuation report. And that report will be made to us sometime in November. But prior to that, at the end of this month, the actuaries are going to be coming back with their demographic assumptions and asking the board to give them direction on the adoption of new demographic assumptions. My expectation is that what they will do is, as they provide the demographic assumptions for the board, retirement board to consider, they'll also say they'll combine those new assumptions with some of the economic scenarios that they already provided back in June and give us an idea of the impact that that would have on the UAL. Because, of course, the retirement board is just as interested in knowing that figure as all of you are. So that's when I expect to get at least the preliminary numbers that will be more complete than what we currently have.
So September, definitely October, we would have, this group would have a better idea as far as moving forward and having more information to make a decision if we choose to make it at that point in time.
The second retirement board meeting in the month of September is scheduled for the 27th, so long about the end of September and early October is a good time frame.
And I think it's important to point out, too, if I might, Mr. Chairman, that the retirement board is an independent body, so they're going to make their determinations. And again, they've been very good about sharing their thoughts with us as a board of supervisors or ad hoc committee. But at the end of the day, we don't decide as a board of supervisors what the retirement board is going to do in terms of setting its assumption rates or any of their assumptions. So it's important for people to understand that I mean, we have membership on the board, but we are not controlling interest in that board, and so the board will do what it's going to do. It was pretty clear to me in our last ad hoc committee that they are going to be looking at adopting a 7.25% investment return rate change. So I think I feel fairly confident in saying that today. But again, it's not because I'm saying it as a board of supervisor member, it's because it's what I'm hearing from the retirement board folks, that that's what they anticipate doing.
And because it was said in public meeting, I'll be happy to share with you the reason that the retirement board is considering a move of that magnitude is because the actuaries have indicated they would not support a continuation of the slow but steady reduction in the interest rate assumption by 5 basis points each year, because currently they feel it's too high to really support.
As an observation, Mr. Chairman and committee members, I'm turning to table I-3 in the actuary's last report dated November 2016, and this would be an explanation. I don't think you have that before you, but I think I can shed some light on the rationale for the increase from $200 million to $238 million in the unfunded liability. Part of it is an increase due to investment loss of $33.9 million, which was then netted against a decrease due to liability gain of $8.9 million. So most of that increase, even though there are other adjustments in the formula, did relate to investments, both loss and gain. And that caused the change that I orally supplemented.
But that's the
to
loss
chart.
that's based upon the 10-year amortization amount, so it's not like a single year loss.
Well, is it both?
It is both.
And we also have potential years of gain that are going to be smoothed out and netted out against that the years of losses. This year, preliminarily, we've got a very good looking rate of return that I think is going to yield positive results for us. And as Tier 4 continues to take over more and more of our active employees and active workforce, which right now they're 30% of our workforce, that's going to further help the unfunded liability into the future. And I don't know that
It doesn't really help the unfunded liability. It helps reduce the county's contribution for ongoing operational expense, because you're paying out less.
Well,
but so you could say you're freeing up more money to pay towards the unfunded liability. But the unfunded liability is the unfunded liability. It still has to be paid.
Well, that's the portion of your plan that isn't funded by the current state of investment returns. And so if you continued on, let's say with the dinosaurs, Tier 1 and like Rolling Hill, if we continued with that level of benefit, our unfunded liability, if we had to continue to pay that, would have grown. So because we're able to pay less to Tier 4, it's going to be decreasing as more and more Tier 4 continues to take into effect into the plan. And I don't know, we didn't really talk, you didn't shed much light on it, Dave, and maybe that's just because you're trying to avoid it maybe, but what are your thoughts about a Tier 5? Is that possible? Is that necessary? Is that a good direction from your perspective for the county to go in terms of offering that or having that be available? It was glossed over, but I just want to ask you.
Let me respond first in a roundabout way to your question, Chairman Vanderpool, and then I will respond directly to it. And the roundabout response is that what Supervisor Worthley has indicated is both right and wrong. The unfunded liability, or actually let's relate it to the overall contribution rate from the county, is being impacted in a positive way by Tier 4 currently. Remember, your contribution rates are two pieces, normal cost and then the amortization of the UAL, or unfunded liabilities. Your normal costs are declining as a result of Tier 4. So your contribution rates, because of that, are going down. Unfortunately, the unfunded liability is of such size that it's overwhelming the positive impact that Tier 4 is having on the employer contribution rates, and you're seeing the net difference climb because of the unfunded liabilities. So yes, it is a problem, and Tier 4, Tier 5 will not address your current unfunded liability issue, but it will lower your contribution rates partly because of the fact that the Tier 4 is less costly to the plan sponsor than the other tiers are. And my assumption would be, to answer to your directly to your question, is that the county would probably consider a Tier 5 that would be even less expensive. My thoughts about a Tier 5 would be that if that's the direction that the county wants to head into, it should have at least three components. One would be a continuation of a DB component that provides a guaranteed benefit of some size to employees, that you continue to have a Social Security component, which we would have no choice because once we're integrated into the Social Security system as a employer, we're in it for life, and a DC component, which again the county already provides through Empower, or Great West was their former name. So there could be a level of benefits that combine all three of those into a Tier 5 that would still provide a nice size safety net for the plan members, employees, and be less costly to the county. So I think development of a Tier 5 is possible, but there are some hurdles to get over, and those would be ones that we would have to discuss in greater detail if the county is really looking to move in that direction.
Mr. Chairman, thank you, Mr. Keeler, and I appreciate all your efforts thus far. They've been very, very helpful. Turning to the Tier 5, if the DB component, let's say, were capped, let's say at 50%, wouldn't that require a change in legislation?
Yes, as we've communicated back and forth, I do think that there's nothing in the 37 Act or in state law that permits the establishment of a DB component that would have a cap of 50% of final average salary currently. So that would be the missing component. Social Security is done. We already are part of Social Security. A DC component exists because the county already has a 457 plan, which is a DC plan, and it has all the specifics of a DC component. But the DB piece would be one that we would have to look at more carefully and assume that we could get the state legislature to support that, and that could be a significant challenge given the fact that Governor Brown basically proposed this same type of structure several years ago and was not able to get it through the legislature.
You want to talk about Tier 6 now?
Nope. Any further questions or comments from members of the public regarding this?
I do have additional requests. That was just the one. I guess the other things that I'd like to see, and I would agree with Supervisor Worthley that I don't know that I'm necessarily ready to make a recommendation today. So even though I was ready to last meeting, I think I've digressed. What I would like to see is a comparison of what we are planning to pay right now, which we already have, versus the various scenarios of what we would pay on an annual basis for the POBs. And so I think there's a few assumptions, based on how much we would borrow for the various amounts and the anticipated rate that we would have, which I think there was some guidance that I don't remember exactly who, if it was Raymond James and K&N, were suggesting what they thought the rate would be. But I would like to see what that would look like as far as, on an annual basis, what would be our savings. Because in this report, we looked at, overall savings on the 20-year cycle. But I don't know if there would be, would there be an initial increase at the beginning where we would actually be paying more, and then over the long term we would have some type of savings. I'd like to look at that, as well as then with that savings, what's our, do we have a plan for that, for the savings amount? What if we're looking at $100 million or $200 million in POBs, then what, are we? There's still a potential for additional UAL. Are we then utilizing those savings in something like a PARS account where we're we're saving that. Is that kind of an additional companion piece that we're looking at that? So I guess that's kind of the direction where I'd like to see something that's a little more holistic, where we say, okay, this is what we can do, and then the additional savings, does that just go into the general fund, or do we do additional things that we, what does that look like?
And if I might just jump in, what I had looked at was looking at reducing our, again, bringing down the rate of return investment assumption. Because again, the more it comes down, then the greater is the risk of hitting the target. So as Dave said, their own consultants are saying that they think 7.25 is probably still too high. It should be something less than that. And the more we bring it down, the better position we are in as a county, because we're going to have a lesser chance of increasing the unfunded liability. The higher the percentage is, the higher the risk is of increasing that. So that was part of what I had been thinking about. But the concept of perhaps putting it into the PARS type of account is not a bad one, too, because of the flexibility it provides.
And let me just be clear, too, from what I have heard from our actuaries, that 7.25 is not an uncomfortable level. That's what they would actually feel comfortable with us being at, and they don't want us to be higher than that. Is that correct? Or was it even... at 7.5, we would still be outside the realm of their comfort. They want us at 7.3?
7.25 was the...
Where was their cutoff of comfort?
7.25.
It was 2.5, okay.
Yeah. And actually, again, not to get too deep into the weeds, but the actuary really looks at what they call the real rate of return, which is nothing more than the function of your investment assumption rate, also referred to as the discount rate, and that's what you'll see in their documents, so that doesn't confuse you. So the investment assumption rate minus the plan's assumption on inflation gives you a real rate of return, which the actuaries would more correctly say their highest number that they're comfortable with is 4.25. So with a 7.25 rate of return assumption and an inflation assumption of 3%, which is what we currently have, that would produce a 4.25 real rate of return assumption that they are comfortable with. But that's the maximum that they would go.
And some of the scenarios in terms of assumptions that the retirement board is looking at, they even suggest an inflation rate of 2.7%, which would then change everything if that was adopted by the board.
True, and some county to the north of us has adopted an inflation assumption that's in the twos. I think it's 2.75, could be 2.5. But again, then to get the real rate of return down to a level that the actuary would be comfortable with, you would have to reduce the investment rate of return assumption even further to get to that 4.25% comfort zone.
So sorry to cut you off. I just wanted to throw that out there.
Well, so I guess just to Supervisor Worthley's point. So if we're looking at, when we say we are looking at, bringing down the possible rate of return, we would essentially, as a board of supervisors, would be saying to the retirement board that we are willing and we're able to pay more from a contribution standpoint. So take that into consideration as a retirement board, that we're willing to do that at the table, because it's still their decision.
Sure.
Correct me if I'm wrong, but that's essentially what we're saying, is that we have this savings where we would be willing to have an additional annual contribution from the employer's standpoint to bring down that rate of return further than what you've already done.
And the retirement board has also offered and suggested in a public session that if this rate of return were adopted, that we could phase in the payment like what Kern County's having to do because of their situation. But from my perspective as a Board of Supervisors member, I wouldn't want the phase-in because I want to just start paying a more realistic rate if we have the ability to.
And to let you know, that's exactly the action taken yesterday at the Air Board, because they were given that same opportunity, and they said, we can afford to do it now. It's $800,000 more to the Air District for that amount. But rather than phase it in over 3 years, which just goes to increase, again, your unfunded liability of what you're paying interest on, I'd rather bite the bullet and pay it now.
Okay.
So those were my asks, Mr. Spada.
Well, it sounds like we're just going to be collecting the additional information, getting it, and then seeing what the retirement board does adopt as their economic assumptions, and then also, I don't know if they're going to be adopting the non-economic assumptions by October, but it sounds like at the October Strategic Financing Ad Hoc Committee meeting is going to be really when we can look to direction being given from this committee to the board.
The agenda items have not been set as yet for the retirement board, but I am fairly certain that action will be taken on the economic assumptions, probably the first meeting in September, which is scheduled for the 13th. And then the actuary will be back on the 27th to deliver the remainder of the report, and likely the retirement board will take action on the demographic assumptions at that point. Then the actuary completes their valuation report and will deliver it to us in the meeting in November, which I believe is on the 8th.
Okay. All right. Any further questions or comments from board members on this? All right. Seeing none, we'll move on to item number 4 on the agenda, which is comments by the committee or the public. Deanne, you're an attorney and you haven't said anything this whole time. Do you want to say anything?
No, I don't.
Okay, that's great. Thank you for contributing. Anybody have anything else?
What are we planning on? Do we already have an idea of what we're going to be discussing next month?
Yes, sir. Number one, if there's a follow-up with regard to the Corizon information, because HHSA wanted to work more closely with the sheriff. Number two, we would make every effort to try to get responses to these questions that this committee has provided. And then number three would be an introduction of the fire department's capital, operational, and personnel needs, and possibly, we could defer this to the next one, the infrastructure costs over time for water and wastewater from RMA. So we are packed.
The chief wants us to just skip fire altogether, but
Well, he only has a $20 million request.
It's not 230 million. 21.
all right. Any further questions or comments from committee members or members of the public? All right, we will now move on to Supervisor Worthley's favorite item, item number 5, adjournment, and you can get to Fresno by 1 o'clock, Supervisor. Thank you for attending today's meeting, and our next meeting is September 12th. All right. Thank you very much, and have a great rest of the day and a nice weekend.